Today, I am going to tell you about the pulmonary tuberculosis, that is also called TB. In India, this disease is spreading all over the part of the India. This is very dreaded disease caused by Mycobacterium tuberculosis. It is its bacilli, bacteria, that causing this disease. Spread by several ways. The main ways are sputum of the infected personnel and by the sputum of an infected personnel who spit it on the earth, it dried and spread this ailment. First of all, these bacteria goes through the mouth to the trachea, then to the lungs and make infection there. The tuberculosis are of three types. The primary tuberculosis, latent tuberculosis, and third is active tuberculosis. The primary tuberculosis, that is the first infection mainly in the children found in early ages, and it involved the lower part of the lungs, and latent tuberculosis, that the macrophages etc., the protective cell of the body, covered the bacteria and kept it in dormant form in the lungs etc., and can spread this tuberculosis further when there is low resistance of the body. Low resistance occur in several cases in debilitating conditions, diabetes and other ailment, and transplant of the some other organs into the body. The disease is spread where there is low resistance. Resistance of the body is play a great part in human being that get easily infected. Bacteria is spread by droplet infection, by air of the mouth, oral cavity and lungs to the people. This bacteria is acid fast bacteria, and it can be produce several symptoms in the body of the human being. The symptoms are fever, cough, body ache, weakness, etc. Some people suffered from diabetes HIV ailment, etc. Due to lack of resistance, they develop this infection easily because they have low resistance. The causes of spread of this disease are overcrowding, lack of spacious accommodations, and lack of knowledge in the people. They don't know how can this infection spread and what they should do for its prevention. Diagnosis of this disease can be done easily by the symptoms plus several tests, e.g. sputum examination, blood examination, X-ray, and other specific tests, CT, etc. In sputum examination, we can do the slide test, smear test, by which we can find out this bacteria easily in slides, and by this sputum culture and sensitivity we can culture it on the several media, and we can find this bacteria. Not only bacteria, we can find the sensitivity also. Therefore, we can find the treatment which can be given, which drug be given to that patient. In blood, there is enhancement of the ESR and lymphocytes, and there is gold test also in the blood, that is 60 to 80% confirmatory test. In chest X-ray, we find cavities in the lungs along with fibrosis, etc. Not only this, we can get finding of the pericarditis in the heart also. This disease can remain in the local part as well as it can be disseminated to the other parts also. It can involve renals, bones, spines, heart, lungs, and brain also. It can involve the intestine and genitourinary tract as well. By this way, as I have already told you, we can do the diagnosis. We know its spread, we know its causes, we can prevent its route of spread. Then there is a part of treatment of this disease also. In treatment, mainly we use 4 drugs: Isonex, rifampicin, pyrazinamide, and ethambutol. Sometimes we used streptomycin injection as well. In normal cases where there is no resistant and patient take continued treatment, the treatment can be completed within 3 months, 6 months, 9 months, 1 year, 1.5 year, 2 year, and 2.5 year. In resistant cases, treatment can be given up to 2.5 years as well. Now you can say, what is this resistant? How it can occur? The population people don't know how many days the treatment should be taken by them after diagnosis. If they will take continuously for 3 months, some people cured, some after 6 months, some after 9 months, some after 1 year. But if patient don't take drugs regularly and break their treatment, then the treatment period increased and resistant develop against these drugs, and time also increased, and there is no surety of their cure also due to this resistance. To prevent this resistance, treatment should be taken continuously. And when you stop their treatment, that should be stopped with the advice of the doctors. They will do certain tests before stopping your treatment. Your body is your body. You keep proper attention on it. You take proper diet also, balanced diet, vitamins, minerals, to prevent spread of this infection, as well as the people who are infected to get early recovery as well. As I have already told you several things regarding your habitat and livelihood, you should keep attention. In case of resistant tuberculosis, there are several drugs. Also we used the amikacin, the doxycycline, the fluoroquinolone, etc. Linezolid also. Not only this, the recent drug is bedaquiline. It is very costly drug. The firms produce this drug on advice of government especially, and the cost also very high, 13 lakhs or more for the 6-month treatment, 188 tablets only. That should be given 1 tablet daily for 6 months. This disease not only a problem of India, it is a problem of the world. It is not a new disease. It is old one. But people are not aware. People have not knowledge. And the people who has knowledge, they don't bound to take treatment regularly. Therefore, irregular treatment causing resistance, and this resistance of these bacteria, the infected personnel further spread this disease regularly. Therefore, we should keep our attention. We should do hard work following its treatment for its prevention, because most of the people, when become infected and resistant, they are unable to do their work. The human being is losing their money, government is losing its money, and it is national wastage, and nation become poor, people become poor. We should do our duty and take part in its prevention. You see, from government side, they have made some DOTS centers, primary health centers, hospitals, and most of the centers have medicines freely available. Still, people are not taking their treatment regularly. Why? They are wasting the money of the country as well as their own. Please look into the matter seriously and do needful. Thank you. Please subscribe my video and like it. Thanks.